In this video, we are going to talk about the benefits of fitness and the guidelines for physical activity. So let's start with the physical benefits of fitness. Now, there are many physical benefits to fitness. One is improved cardiorespiratory endurance. Another one includes improvement in your blood pressure, in blood lipid levels, and blood glucose markers. You also gain muscle mass and strength. There's an improvement in flexibility. There's improvement in bone density, and people tend to have better sleep. Along with physical benefits, there are psychological benefits. Exercise and physical activity can improve mental health, improve quality of life, and reduce stress. And lastly, let's talk about the benefits of disease resistance. It can reduce your risk for diabetes, cardiovascular disease, and some types of cancer. Now let's move into the physical activity guidelines. The US releases physical activity guidelines about every 7 to 10 years. For children and adolescents, the recommendations or guidelines are that children get at least 60 minutes or more physical activity of moderate or vigorous intensity every day. And that should include some aerobic activity, so daily aerobic activity like walking or running or riding a bike, or many sports fall into this category. About 3 times a week, they should do some muscle strengthening activities. For kids, this could include things like playing tug of war or climbing a rope or a tree, or doing sit-ups or doing push-ups or climbing walls. And then they should do about 3 days a week, they should do some bone strengthening activities. This puts weight on the long bones. So it could be fun things like hopscotch or skipping or jump rope or even running or gymnastics or some sports. Now, the guidelines for adults include moving more throughout the day and getting at least 150 to 300 minutes of moderate activity every week, or 75 to 150 minutes of vigorous activity weekly. Now, if people are at the high end, the 300 minutes of moderate or 150 minutes of vigorous, there's an added benefit that there may be some weight loss. So what is a moderate activity? Well, that increases your heart rate and your breathing to some extent. If you're thinking on a 10-point scale, this would probably be exertion of about a 5 or 6. So examples would be brisk walking, dancing, swimming, or biking on a fairly level terrain. Vigorous activities greatly increase your heart rate and breathing. On that 10-point scale, you're probably at a 7 or 8. Some examples might be jogging, like singles tennis, swimming continuous laps, biking uphill. Now, adults should also participate in muscle strengthening activities 2 times a week. They could do resistance bands or calisthenics like push-ups, sit-ups, pull-ups, even carrying heavy loads or heavy gardening, digging, and hoeing. The key is that you need to be working the muscles more than usual. Then we have physical activity guidelines for older adults. Those are people 65 or older. They're basically the same as adults, but they have one addition, and that is balance exercises. So they can do even simple things like walking backwards to help with balance, or what's called heel walking or toe walking, or practicing to stand from sitting. That helps. Then another thing with the older adult guidelines, if they have a chronic condition that doesn't allow a lot of physical activity, the guideline is to be as active as possible.